here on Prime Morning. It's time for us to get into a health conversation here on the show. So you can send your messages on our WhatsApp line and on social media as well. Yeah.
Yes, it's time for Good Living segment. And before we went on a break, Rosalind Felly gave you, a tad bit of what the conversation for Good Living segment is. Today, we'll be talking about urinary tract infections, not in general, but specifically and mainly in pregnant women, because it seems to be highly, highly prevalent. And so we have our doc in the house this morning, Dr. Akosia A.A. Adai. And she says the A.A.
Oh, okay. I want to know the A.A.
Yes, I'll tell you the A.A. So, a charma.
Yes.
And I was telling her, that I've never heard of a charma. But only a charm.
Yes. No, I think I've heard.
You've heard a charma?
A charma, yeah.
Okay.
An auntie of mine was called a charma.
Oh, that's nice.
So we made it shorter. I think we'll call it auntie charma, but it was a charma.
Oh, okay, auntie charma.
She's passed on, actually, yeah.
Okay. So I think I'll call you not AQ. Not AQ, because it's 4 A's.
It's 4 A's. A4.
Good morning,
I didn't even notice.
Good morning.
How are you?
I'm great. How are you?
I am great, and KMJ is super duper.
Good, yeah.
He's fine as well. So today we are talking about urinary tract infections in pregnant women. Let's start off by identifying what urinary tract infections is.
Okay, so I'll try to keep things as simple as possible. So when we say urinary tract infection, it's just infection in the urinary tract.
Okay.
And by urinary tract, we are talking about first the ureters. What the ureters are the passageways where the urine passes through. Then we have the bladder, that's the storage component of the urine. Then it can go as high as the kidneys. That's what acts as a filtration unit.
So it doesn't only affect the ureter.
Yeah.
It affects the bladder.
It can.
And it affects the kidney.
Yeah, it can.
So these three.
Yeah. So it can progress upwards.
Okay.
Yes.
Okay.
Yes.
Okay. So tell us some of the symptoms of UTIs.
Okay. So the first and most important I'd like to stress upon is what we call dysuria. So this comes as a burning sensation or pain when you're trying to urinate. Urinate, you're feeling pain. You see, and it's very significant to us. Well, there are other symptoms such as frequency, where the patients will come, they've been having frequent times when they urinate, they'll be urinating a lot, right? Sometimes they wake up at night to urinate more frequently than usual. And there are other times when you urinate and you still feel as though there's still some there.
Oh, you're not able to pass everything out.
Yes, so you still feel that need. And there are other times too that you urinate and then you feel as though it doesn't take long. You go back to the bathroom, you need to urinate again. So I'll also say that when it progresses, it can become systemic, where you have people coming with fevers, abdominal pain, nausea, vomiting. Yes, when it reaches that stage, we are sort of worried, but don't worry, it's something we can easily work out. So basically.
But with what she's saying, I don't know, it sort of has some similarities with, it can easily make you think that maybe you've caught an STI.
Well, because actually most STIs also present like that. That's the thing. That's why screening is very important when you have these symptoms you come through. And the other thing that we must also notice that these symptoms I'm mentioning, especially the frequency, where you're urinating a lot, you're feeling like some is still in there. Well, pregnant women, for instance, specifically, naturally have those symptoms too.
Yes.
Because of the fetus, the impact or it has on the bladder.
Okay.
So you have to have a high index of suspicion for that. Okay. So usually outside, we're always doing screenings to try and find out what is going on, because the pregnant state is a special state. You have to take care of the mother and the baby.
Okay.
That's what I wanted to find out. For example, I drink a lot of water.
Yeah.
frequency in urinating, I think it's something that if you drink more water,
lot
you'll
of
be
water,
likely to experience it.
Exactly.
Somebody might be worried that, okay,
Yeah.
so at what point should the frequency be of a worry to you? Is when you know you're not drinking more water or fluids, but you're urinating.
Exactly.
Or,
Yes. Exactly as you said.
Okay.
And it's just not one symptom we take. We look at the whole conundrum, then we put it together, add our investigations, and we come to a better diagnosis for you.
Okay. Now let's come to the pregnant woman.
All right.
Who is infected or who has UTI. Now, you mentioned earlier that it's a regular thing that a pregnant woman will be frequently urinating. So how can she tell, other than that frequent urinating, that she's caught UTI?
Okay. So most of the time, as I've said, we do a lot of screenings. There are even patients who come, or people who come who are even asymptomatic. They do not have symptoms at all.
And that's the other side of it.
Okay.
That's the other side altogether. They do not have symptoms at all.
Okay.
You understand? That is why pregnancy, for instance, you are supposed to go for your ANC, antenatal checkups. And during these antenatal checkups, you come to us, you explain what is going on with you. And even when, most of the time, even if that is not what you are bringing, I will always do tests. So you have a lot of people, they don't have complaints. They come. When we do the test, we find out that they actually do have these infections going on. So we are able to catch them early. Lucky for us.
Is there a point the person has to maybe a period? So periodically, between 1 to 2 weeks or between 3 to 4 months, the person is supposed to come. Or
The
it's just that, the testing. It's just that it's open.
Well, I would say if you're talking about the pregnant woman, right? Pregnant women specifically, we have times when they come for ANC, antenatal checkup. Okay. So regularly when they come, we do those tests. However, if you have any of these symptomatologies, you just come in.
Just come.
Yes.
Yeah.
Just, it's always open. Whatever day, we are always around to listen to you.
Yeah, but the moment you go for antenatal, it's supposed to be some...
We always do a lot of urine
I'm
checks.
asking because my kid says is pregnant, so
we always run.
And she tells me when she's going, so
Right.
I want to be sure if they add all
It's
that
always
to
added.
it,
We always go through. We always go through. And if you
Okay.
need to do further checks, we do that. We always do that.
Right. Okay. So this is Good Living segment, and we are talking about urinary tract infections in pregnant women. And Dr. Akosia, I wanted to
Add a charm.
but Doc is here with us. She's a medical doctor, and she is giving us insights into urinary tract infections in pregnant women. And so please get interactive with us on our social media platforms. Our WhatsApp line is also active. You can send us your message through 055-157-5757. 055-157-5757 or our Facebook page at Joy Prime, and we'll definitely ask Doc your questions, anything at all that you want to ask in relation to UTIs in pregnant women. She's here for you because we are dealing specifically.
So especially the pregnant women.
Yes. So if you are you're pregnant, a relative or a friend who is pregnant, please send in your questions. Doc is here to answer them for you. Now, Doc, let's talk about the risks in relation to UTIs that haven't been treated, untreated UTIs in pregnant women. What could be the possibility of how far or the dangers that it could go in a pregnant woman? Because you are saying some will not even show symptoms. But it will be there.
That could be
and it could be, exactly. So an untreated UTI in a pregnant woman, what are the risks associated with it?
Okay. So let's go back a bit. When I was explaining what a UTI was, I explained that it could be at the passageway, the urethra, the bladder, or the kidneys. And it's ascents. So the bacteria ascends.
Goes up. Okay.
Exactly.
Okay.
So it may start in the urethra, untreated, go to the bladder and cause something called cystitis, inflammation of the bladder. It can go all the way up to the kidneys, cause pyelonephritis. Okay. If it further goes untreated, then we have a whole systemic conundrum. That's to the maternal side. Okay. Then the fetus, the baby. Yes, our poor baby. So these babies cannot even grow properly in the womb. they come out with low birth weight, right? Some of them come out premature. And it can even lead to you even going to labor before your time.
Oh.
Okay. So sometimes when patients come to us and they're in labor before their time, we're always trying to find out if they have a urinary tract infection that could have precipitated that. Some even have miscarriages. If a patient comes early first trimester and is bleeding, right, we now have to do screening to be sure that there's no associated infection that is precipitating this.
Okay.
If there is, we treat it. Okay, so that's why it's something dear to our heart. It's something that can easily be identified and treated.
Okay.
So I'm happy I'm here to actually throw light on it.
Yeah.
I mean, yes.
So let's look at the diagnosis. Now, what the processes, what is it like? Is it difficult? Is it painful? Is it expensive?
So the beautiful thing I said, like, it's actually so simple. So simple. So first of all, we have, we can do a urine dipstick, what you call a urine dipstick. Even that, you can go to a pharmacy and get it done.
Oh, okay.
The only thing with it is that it is dependent on the person who is reading. So you get the urine, dip it in. It's a dip stick, so you dip it in, and it's supposed to be read at specific times. So basically, if the person reading it makes the mistake of reading it at a different time, it will affect the results. Okay, that's the most basic.
Okay.
Then we have the urine routine analysis, what we call the urine IRE. So there you send it to the lab, yes, and they will bring up the microscopic details of the urine. Okay. Then we can go further to do the urine culture. Most of the time, we do the urine culture when a person comes to recurrent UTIs. Or we can do it in those patients who we've started antibiotics for, empiric antibiotics, but they are still not getting better. So we culture, see what organism specifically is responsible for this infection. Then with the bacteria, we have sensitivities that are done. These sensitivities will show which antibiotics are resistant and sensitive to these organisms. Then we start the patients on that. So it's relatively very, very simple.
Okay.
And it's not expensive.
It's not expensive.
It's not expensive.
Okay. Now let's come to how one can get UTI. But before you answer that, I read in an article that the female anatomy contributes largely to a woman getting UTI.
Great.
Please explain that to us.
All right, beautiful. So where the urethra is, you know, the female anatomy is an open space. Let me put it plainly like that. It's an open space. Where the urethra is, the opening, right, is just right above where the vagina is.
Okay.
And then the anal opening is right underneath, okay? So fecal matter comes from the anal opening, obviously, right? So there's already that open space for the bacteria to easily go there.
Right.
That's why most of the time in women, in trying to prevent, we're always preaching hygiene. Don't wipe from
the back to the front. Yeah.
Exactly, because you're just sending bacteria straight away there.
Okay.
You understand?
Yes.
So that's what makes the anatomy make us more prone to it.
Okay. Now let's come to what some of the things that we do mistakenly or knowingly and all that makes us acquire UTIs.
Okay, so before you mentioned one,
yes,
right?
Yes.
Hygiene. Another thing too is that most of the time when we are doing sexual intercourse, for instance, it is always better to clean up before and after. And
before sex,
yes,
and after sex.
Yes,
As in wash down.
Yeah, wash down.
Okay.
Yeah,
maybe somebody might just say use tissue to clean up.
Wash down.
Yeah, wash
down.
Okay.
Wash down. Because we know we already have our normal bacteria on our body, skin flora. Yes. So if not, you just introduce bacteria straight there. And the other thing is that even after sex, you're supposed to urinate. It helps.
Oh.
Yes, urinate.
Even when you don't feel like it.
Drink water, urinate. It's good. It's good.
Oh, yeah?
Studies have shown it really helps reduce the risk of that.
Oh.
Oh yes, it's very important. And drink a lot of water.
So maybe before they ask you drink a lot of water?
Well, feel free. I always advocate for drinking a lot of water. I mean, drink a lot of water. Okay.
Yeah.
And those who have what we call comorbidities, those with diabetes, hypertension, other illnesses, they should take care of themselves, because the truth is that the moment you have something like diabetes, you are what we call immunocompromised.
Okay.
Meaning that you are relatively at a higher risk of getting infections than someone who is not.
Okay.
So you have to also make sure that any other ailments you have, you treat, manage it. That would help reduce the risk of these infections.
Okay. And any other? Or that's it basically.
Oh, that's
so
basically
hygiene.
balanced diet.
Balanced diet.
Exactly.
Does exercising do anything?
Oh, of course.
Okay.
Drinking, smoking, the usual.
Okay.
The usual. But always say drink a lot of water. Flush out your system. Flush out your system. That's basically it.
Now,
it's actually simple. It's not so complicated. It's just like taking care of yourself. Just take care of yourself. Watch your hygiene as well. That's for the female. Just watch your hygiene. And you know, for pregnant women specifically,
yes.
they have a big belly.
Yes.
Hygiene is a problem.
Yeah.
They're always tired, trained, going up and down. It's quite stressful for them to now bend and then wash. We understand that.
Is that where the men come in?
Yeah, I think so.
Yeah, you can help.
I think so.
Help the women. Help the women. I mean, because you should understand their state. So they are able to have their hygiene at a very good place where they are able to not catch these infections.
Yeah, especially the fact that you have to be, the hygiene pact, which means that every time the woman has to be cleaning up and all of that, that should be a man's responsibility now, right?
Well, I'm
just saying. I'm just saying that it means that it becomes a man's responsibility now to be bathing the woman.
But just mention exactly that you want to know exactly what you want to do.
That we should be bathing. Should be bathing the pregnant women. No, but I don't know how many men will, bath their wives.
Oh, just encourage her. I mean, just encourage her. The part she can't reach, I mean, you can always help her.
You always have to be there.
Right.
No, it should be our responsibility now. I think I'm getting where we're going. We should be making it our responsibility. Why?
So, KMJ has a question for you. KMJ, please feel free and ask.
So, I mean, really, hygiene is very important. So it means that if the person is not bathing regularly, there's higher risk.
Oh, of course.
Of the person getting the disease, the infection. So, bottom line is that I'm advocating for men to bath women now.
I was just waiting for you to say something like that.
Guys, let's make sure that we're always bathing the women, whether they are pregnant or not. Is that not what you people say? TLC or TCL or whatever you people call it? TLC, right? So let's do it, whether they are pregnant or not. Dog. So let's look at the other aspect of it. For example, if I have it already and I'm taking care of it, how long does it take for the treatment to be done? Is it a long process or it takes just a while? What are some of the medications that are available and all that? Okay.
It actually depends on the type of UTI you have, the infection.
Okay.
Most of the time, the UTIs are caught early. So we just place them on some antibiotics for 5 days, max 7 days, and then it's
really simple like that. Once you're ready to take off it.
Yeah. For pregnant women, we catch it so early. Unless they are not going to antenatal, of course, then it becomes a different issue. But if not, it's a simple procedure. The only issue would be with pregnant women, it's not every medication we can give.
Yeah.
Oh, okay.
So there are straight up limitations to that. Okay, because some of them can impact the fetus, the growing fetus. So there are some medication that can affect the bone of the growing fetus. We avoid that. Some can affect the hearing. Some can even cause cardiac effect. There are some that we can't give during the first trimester. We can give during the second and third. So we look at all of that to make a decision. So fine, we are limited in medications, but we still have options to help you. And luckily, we catch them early, so they do not get complicated for us to now think about other ways to solve the problem.
Can you self treat UTI?
Well, I honestly wouldn't suggest that. I really honestly wouldn't suggest that. Because, first of all, I said that UTIs, right, medications, especially for pregnant women, depend especially on even their gestation. First trimester, second trimester, third trimester. It's not every medication you can take.
Yes.
So if you go to the pharmacy and unfortunately you're giving them medication just like that and it affects your baby, well, you understand.
That's on you.
Exactly. So you will have to come in. It doesn't take long. Just come in. Let us see you. Then we'll help you out.
Tell us about the statistics of women, pregnant women in Ghana, getting UTIs.
Okay. So what I would say is that let's start with women in general getting UTI.
Okay.
So we'll say statistics have shown that relatively from men to women are 14 times. Yeah. 14 times? Yeah. In getting UTI. So when it comes to the non-pregnant and the pregnant woman, the rate of getting UTI is actually quite similar. The difference is that pregnant women tend to get recurrent UTIs.
Okay.
That's the difference.
Okay.
Recurrent UTIs.
Okay.
Because of their physiology, the change in their physiology with the fetus.
So if you're pregnant for 9 months, between that 9 months, if you're not really taking good care of yourself,
you can get it over and over again.
Oh yeah. Over and over and over and over and over again. And when it happens,
that means you're dying slowly. Be that.
But it doesn't kill.
Oh,
it doesn't kill.
Oh, hardly.
Oh,
That's what I'm saying. It is caught early. Most of the time, it's caught early. When we become scared, is when it becomes systemic. When a person does not come to the hospital, then it moves to other places. Then we have an issue on our hands. But if not, it's fine.
Okay, Doc. We have some questions. Let me read some of the messages here. Okay, so this one says, "Hi, please. Usually, when you want to get pregnant, it's advisable you stay in bed after sex so the sperms can travel inner. But if the woman should urinate or bath after sex, then it will reduce the probability of having a baby." Anna or the Anna also. Is that right?
Oh, so he thinks that if you want to get pregnant after sex, you stay.
You have to stay and relax. For the sperm to travel.
So it means that if you stand up right after the sperms will not travel.
It won't travel.
Guys.
So he's saying, so if you go urinate, then it means that you're urinating the sperm out as well. That's what the person is trying to say. But let's take the next.
Doc, what's your opinion on that? Okay, what's your
in all honesty, when you're having sex, the person has ejaculated. The sperms naturally know where they are traveling to. Those that will travel,
know their way about.
They will travel.
You can't force them.
I mean,
no matter
you can't force
how many times you stand and jump.
I mean.
You can't force them. Otherwise, okay, the next one, Beatrice, please, I want to know if the urinary tract infection can lead to miscarriage. Yes, Doc mentioned it earlier that it can lead to a miscarriage. Please continue sending in your messages, your questions to our WhatsApp line or our Facebook at Joy Prime. Okay, so we have some messages from Facebook, KMJ.
All right, so this one is from Osei David. It says, "Madam C, thank you, okay. With our job, sometimes we would be in a long trip and I keep urine on myself for long and my abdomen do pain me a lot." That thing could be scary too. The keeping of the urine. As for if I go anything, as for that one there, bruh, if you change your mind, find somewhere where you need to. You have no idea. Rick Solo says, "Good morning. I am watching live from NG. Keep up the good work." Okay.
Thank you very much.
Yeah, those are some comments on social media. You can send yours as well. Do we have more?
No, not yet, yes. But please keep on sending in your questions. Doc is here to answer them for you. Anything at all in relation to UTIs in pregnant women, or maybe UTIs in general, Doc will definitely answer them for you. Okay, so we have, let me take this one. It says that, "Doctor, please, is it transmittable? Good morning for the education. Kojo Takrade, thank you for your message." Yeah.
Okay, so first of all, we are dealing with bacteria. Okay, so the thing is, if the bacteria it is possible that the bacteria can translocate right, it's very possible because UTIs are just from bacterial infections. So they can translocate but they are not, I won't call them, they are not sexually transmitted infections. You understand?
Okay.
Yes, exactly. That's a different ballgame altogether. But
You
the
know,
same bacteria can cause.
Yeah.
The same bacteria can
There's this
cause
thing that goes around that men are carriers of it. KMJ.
Men are carriers of it.
Yeah.
With the carry on.
You're carriers of UTI.
Oh, but UTI. They said it's hygiene. If you say we're not buffing you, so you are carriers, now I understand. Which carriers again? No, is that what it is? No. Come on, don't put all of these things on us now.
Okay, this one says, good morning, please, I just joined. If you have a question, please send it to us immediately. Oh, so, there's so many questions coming. Oh, wow, okay. Good morning, please, can UTI also cause infertility?
Now, that's a different ballgame altogether. So, usually, infertility is more prone to people get STIs, and that's
so know the difference. So STI, UTI
can cause that. However, we can also see that's what I'm saying. UTIs ascend.
Yes.
And it still causes some inflammation. Okay. So depending on the degree, it is possible. But what is notably known to cause infertility are STIs.
Not UTIs.
Notably, STIs.
Get the difference, because before somebody says that it's the UTI.
The UTI is also, yeah. Okay, this one says, hi, please. Okay, so the same person who was asked, please don't call the WhatsApp line. I'm pleading with you. It interrupts us reading the messages that are coming in. This one says, also, when you're pregnant, the nurse don't check UTI. They only check urine protein. So the pregnant woman only knows when she is sick and has to do lab.
So usually what happens is that we have, when you come in, we let you do some specific labs. And the thing is that they check protein, they check sugar, and they check what we call leukocytes. They normally do the dipstick. So if you are sent to, the nurse checks that, if the leukocytes are positive, then they send you to see us. That's what always happens.
Okay.
So most likely, maybe you do not see, but it's always checked.
It's
in the antenatal book.
Or maybe they just don't tell you.
Exactly, maybe because it's negative. They just don't tell you. But it's something that is always checked.
Okay. So it's something that you do as a must.
Oh yes, you can check. They can check the ANC book. It's there.
Okay. All right. So this one says, can oral sex cause infection? This is Freeman from Tamale.
Rich there.
Wow, I know, right?
It's rolling and coming.
Boys are on standby.
So as I said, anything that will cause bacteria to get there to the urethral space can cause that. And the mouth is a host of a lot of bacteria. I mean, that's why I'm saying, regardless, when you're done, pee at least. Get some out. Get some out at least.
Okay.
The men are also supposed to do the same, right?
Oh yeah, why not?
The men are also supposed to pee.
Oh, why not?
You have been peeing a lot.
Okay. Oh, we need to get serious. We are very serious on here. Good morning. I'm watching you live from Northeast, and I'm really enjoying the show. Thanks for the education. Thank you so much for watching. Continue watching. Good morning, please. I want to know the symptoms of UTIs. Doc, we've already mentioned it, but Doc will just brush it on the surface for you. Don't worry. Please, is it normal to be having blood spots or bleeding when pregnant? Is it blood spots as in your urine? What specifically are you asking? Please make that clear for us and send it back. Send it again. This one says, please, I want to ask if the UTI affects pregnancy continuously. Doc said that if it is not treated, there's a possibility of it reoccurring. So you just need to be very careful as a pregnant woman and be constantly doing your checks. Constantly. So many messages, Doc. Good morning, please. I want to know if pregnant women can use Dettol in cleaning herself.
Oh,
Dettol.
Cleaning herself Is this person specifically talking about her
I think
private?
so. I think so.
too.
I think so.
You know, we always see that area is quite self-cleansing. So a lot of water, gosh, the area of water is fine.
Okay.
In all honesty.
Okay. Good morning, please. I want to know if pregnant woman can. Okay. I think the person repeated the question. Good morning, please. Can heat in panties cause this infection? Heat in panties.
You know,
Or let me just put it, dirty panties.
if you
Heat.
say dirty panties, you already have the answer.
Yes. But they
So
But you know something about heat, right?
yes.
Heat actually creates an environment for bacterial growth too.
Okay.
So sometimes they'll say wear loose clothing.
The heat doesn't kill the bacteria.
No, it creates a nice environment, like
A very warm,
The long-
environment of
like
bacteria.
even that's why even the fact that when you are not urinating frequently and you are still keeping it, it creates a beautiful environment for bacteria to grow. That's
Okay.
basically
So
it.
you can get UTIs from
That's why
heating panties.
even that. So the whole thing is that most of the time we will say free yourselves a bit. Free yourselves a bit and try and wear some loose clothing.
Yeah.
Yes, it helps.
It helps.
Airy environments, it helps.
Okay, so most of our ladies are doing well. Those who are
With the whole.
the slim they're doing well. That was giving you a lot of space.
A lot of space, huh?
Right, Doc?
Well,
Yeah.
Someone wants to know, please, what about men too? Do men get UTI? And please, is it normal for a pregnant woman to have discharge during pregnancy?
okay, so do men get UTIs? Of course. I've already explained the prevalence.
Yes.
Yes, not as much as females. Yes. Well, it's not normal to get discharges. So to that person, please go and see your healthcare provider and let's look into that.
Very interesting message here. Good morning to you all. Good morning. Please, I got UTI from keeping urine in my bladder for long periods and treated it with antibiotics. I got it again from sex and treated it with antibiotics. Since then, it's been reoccurring and I sometimes have cloudy urine. What do I do before getting pregnant? Thank you.
Okay, so first of all, I think this person already knows her risk factors for getting the UTI, such as keeping the urine in her bladder for a long time. And obviously, it seems her sexual just cause is also helping promote this. So she should refrain from that. And if she's having a recurrence of this, I would suggest she goes to a healthcare provider.
Right.
She gets a culture done to be sure the appropriate organism that is causing that. Because sometimes maybe you are taking the antibiotics, you feel well for a second, but you've not actually done much actually. So you just go to get a culture done, then you find the actual organism causing that, then you properly treat. Okay, not self-treat. The fact that you cannot self-treat, please go to your healthcare provider.
Because I think with this one, she knows that.
She already knows.
Yeah, she already knows it, but she just ends up getting antibiotics to treat it, and she stays by. That's why it keeps on reoccurring.
Yeah.
So please make sure that you are doing the needful. This one says, good morning. I once had UTI and was treated and went for review, and everything was fine. But after some time, I felt like I always had some urine left in my lower abdomen. Let's say for the past 2 months, I keep having that feeling, like some left urine. Does it call for concern? Can it be another issue?
Okay, so there's always the possibility of it being another issue.
Okay.
I can't take that away. Okay, but that's what I always say. Still go to the hospital, get checked. Relay your symptoms to the doctor, and then they will most likely do some labs and get the proper treatment for you. Okay, that's not the proper platform for me to diagnose you just like that, yes. So just go to the hospital and they will check it out for you.
Okay. How long can a man carry urinary tract infection?
How long can what?
A man carry
A
urinary...
man
A
can
man
carry. Oh, wow. Oh, okay. That's what I'm saying. Urinary tract infections can even be asymptomatic. It can be on the person for a long time. I can't give a period, but it can be on the person for a long time. The person would not even know. You understand? Aha! Sometimes it can be an incidental finding. You come to the hospital, we are checking for something else, and we find it. And we can't even tell how long the person has had it. So the person does not have symptoms. So we can't give a definite time.
You can actually have it for like 6 months.
Oh, it's possible. And you
more.
just be,
And you wouldn't know. You
you
just
don't
be
really
there,
know.
no symptoms.
But that means
You'll be
dying
peeing
slowly.
regularly.
Not exactly. So you see, let me say, let's put the non-pregnant woman aside. Usually your immune system also does its bit.
Okay.
Okay, to try and keep things a little, you know.
Okay. So it doesn't just kill, like, no matter how long it stays.
It has to really progress for it to be such a problem. Do you understand? It's just the discomfort that worries a lot of people.
Okay.
The discomfort of it, yes.
And the boys like
Okay.
That's not because they are not worried. They're not worried about it.
Okay, so the person who's asked about is it normal to have blood spots or bleeding with pregnancy responded by saying not in the urine, but blood spots as in menstruation. So she's pregnant and still menstruating.
Okay. First of all, I need to know, there's a lot of details I need to get
From
before, yes.
Okay.
Yes.
Okay.
But honestly, she should see her doctor.
Yeah, because
That's important. She should see her doctor.
is-
Seeing blood spots is not something you see. Sometimes it happens, you just have a few, but it depends on how old the baby is in the womb and all of that. So please see your healthcare
Because one can
provider
bleed
immediately with
whilst
that
pregnant.
complaint. Yeah, yeah.
Oh, really?
That's what. Sometimes it's just a few spots, but sometimes even when you are pregnant, let me say 2 weeks after the whole, we have something called implantation bleeding. So I mean, yeah, but I don't know.
it shouldn't be as heavy as.
Yeah, I think you should go and see the
menstrual.
doctor.
Okay.
Anytime you see blood spots, see your doctor.
Just see your doctor,
Yeah.
right?
Okay, so this one says, "Good morning, please. Whenever I use the public washroom and I come out, the next thing or time I found out is itching, and that only. Please, I have at work. Sometimes I have to keep the urine to like close. Okay, so you don't have a choice. You need to just use the public one. So it means that if you're not, urinating there, then you're keeping the urine until you get to the house.
Imagine.
Yeah, that's dangerous. And then
Not
again,
good.
I was saying this thing is dangerous. Don't do it, bro. We need you. The brotherhood needs you. Rich Solo says, "Good morning." Okay. Nanama Daniel says, "Big sis, I'm watching you live at home. We are all proud of you."
Oh, so cute.
At the end to Okay, so those are some of the comments that have come. Do we have more?
We have so many messages. This
Hey,
one says,
people yourself
"Hi."
out.
People are suffering. No.
Okay.
But I'm excited about Prime Morning. That we are doing amazing.
Yeah.
We are doing
Yeah.
amazing.
Yeah.
So this one says, "Hi, please. I'm 9 months pregnant and I have a sore in my anus and it's like piles. Is it also a UTI?"
Oh boy.
Okay, wow. First of all, I hope the person has
Oh my doctor,
complained.
wow.
I hope the person has made that complaint to her doctor. I really hope. I think a lot of us are not going to see our doctor.
Yeah.
That's true. Yeah, from
Yeah.
what we're reading now.
Yeah.
Really, they're just there.
Yeah.
So I would suggest the person see their doctor. But if the person is saying it's in their anus, it's not a UTI.
It's
We're
not
talking about urinary tract
Right.
infections.
And the anus is not
yes.
a place for urine. So. Right, so doctor, there's something here. I've never heard of it before. Does UTI cause chemical pregnancy?
Chemical pregnancy, I have never heard of it before too. Wow. Okay.
This message, you have even wowed the doctor. Okay, let's move on to the next one. Good morning. My question isn't related to UTI, but I will appreciate it if you help me out. I'm pregnant and in my first trimester, and I feel severe pain in my abdomen 4 to 5 times daily. Please, what could be the cause? The pain comes and goes. Can doc help?
Okay, so it can be a number of things. Sometimes just a baby growing. Just a baby growing can cause a pull on the ligaments and cause pain. Okay, it happens. All right. It can also be other things. All right. So something like this, I can't say you don't have a cause for concern because it could be something like what I just explained, which is not anything so serious, or it could be something serious too. So as usual, so they have said it, like I think more than 10 times already. Please see your doctor.
Please see your doctor. Please see your doctor.
Please do.
Okay, so I'm presuming that the previous message asking about does UTI cause chemical pregnancy, actually the person meant cervical, as in having to do with the cervix or something. That's what I'm presuming that maybe the person was trying to say.
Oh, okay.
Anyways,
But if that is what it is, could it be a problem?
Cervical pregnancy.
Yeah, pregnancy.
Cervical pregnancy.
It's not even.
The person will have to retreat if the person is talking about ectopic pregnancies.
Okay.
Pregnancies in different, locations.
Okay. Next one, please. I'm working in a restaurant and we use the same washroom with a lot of people that visit our place, and most of us have been treating the infection over and over again. Please, what can we do?
Hygiene. Hygiene. Public restrooms are susceptible to a lot of bacterial organisms all over. That's very true. So hygiene is like, top. You really have to carry your go bag with your Dettol to clean the seats. Always think about yourself first.
Always think about yourself.
Yeah. Always think about yourself first.
Okay. Hi, please. Is it normal for pregnant women to feel burning sensation after sex?
Please come to the doctor. Let's see you. Well, it's not normal. It's not normal. Burning sensation is not normal. So it could be anything, but yes, it does not rule out a UTI. It could be that too. Okay. So please come in and let's see.
It could be. Yeah. Someone has a message for you. I can't wait. Someone has a,
please read it.
I also have a message.
Someone has a message for you. Anyway,
I have a message for the person.
See, ladies and gentlemen, we're excited about this conversation, but please don't call the WhatsApp line. The number you are seeing on your screen is for WhatsApp only. WhatsApp only, not phone calls. We are not answering phone calls. WhatsApp messages only, not WhatsApp call, please. Not WhatsApp call. They are actually calling on the regular line, not WhatsApp call. So please stop calling the WhatsApp line and just send your messages to that number, and that's it. This one says, hi, please, is it? Okay, so that's what we read previously. I want to read KMJ's message, but let's do this one first. Naka here, I have JJ stent removal and was given no antibiotic. Please, you know that?
Yeah.
Okay.
Yeah,
I want to know if I'm prone to have UTIs. Also, I sometimes itch and have been waking up at dawn since I had JJ stenting. I drink a lot of water though. Can I go to hospital to get screened, and is it expensive?
First of all, any form of instrumentation, no matter whenever you put something in you are at risk of these things. Okay. So if the person is coming with these symptoms, yes, please do go to the hospital, get screened, and it's not expensive. Okay, depending on the hospital you go, but generally it's not expensive at all. Insurance should cover it if you go to a government hospital.
Okay, so I want to find out, maybe before we get into some more messages, I want to find out, why is it that it's not really much talked about? Is it because people don't really know what it does, or because it does not kill?
Well, that's the thing.
I'm hearing this conversation for the first time, and all that. So I may even be in that, people who think that, well, it's not really something a lot of people talk about because
it's just there.
Yeah.
I feel like the fact that from my end, it's quite common from my end, the profession I'm in. I see it a lot. Okay. And the other thing is that it's true, it's not talked about a lot. And it could actually be attributed to the fact that most of the time it doesn't lead to severe complications. Yes. And when most people, for instance, too, have these symptoms and then they think it is something else. Right? Some too, they don't even think that frequently urinating is even attributed to that. Because you may not have the pain, you may have something else.
Yeah.
Yes, you may have something else. So it could account for the reason why a lot of people actually do not know about this.
I see. Any?
Yes, let me read KMJ's message. Good morning, I'm watching you live from Northeast and I'm really enjoying the show. Thanks for the education. Hi, KMJ is really making the show more fun and I like his vibe.
If we don't do like that, they will not listen. They will not go to hospital.
Even Doc agrees.
I agree.
Oh, no, you do. Yeah, so we'll go to the hospital and check.
Okay. Let me take a few more. Let me take about 3 messages at a go, like 3, 4. So, can UTI cause someone to have small or an amount of urine dropping after urination? Good morning. Okay, so he added a good morning. Next one. Good morning, please. I gave birth last 3 weeks, but my baby died few minutes after. Oh, so sorry. And the midwife said she died as a result of an infection. Please, what kind of infection could cause the life of my baby? Because I never missed antenatal and I took all my medication.
I can imagine.
Yeah.
I can imagine how this woman feels.
Any more? Okay. So, first of all, I'm sorry she lost her baby. That's very unfortunate. I will still need to know the circumstance surrounding that. And that's why I'm saying UTIs can cause a lot of things. Preterm delivery, delivering before the time period, babies can come out very small, right? But there are other infections too that may not have to do with the urinary tract. Right? Sometimes you have something called a meconium stained liquor that can actually cause infections to the baby when they are born as well. So we'll have to know that what exactly happened for me to actually be able to be sure what could have caused it. But an infection is still possible. Can even be UTIs can lead to an infection of what surrounds the baby, the water around the baby. Yes. Amniotic fluid, that's what we call it. It can lead to infections with that, and that can lead to the death of your baby anyways. So, well, we can't place it, but there are still a lot of possibilities.
Okay. Do you have any questions?
Yeah, so in that case, maybe if I'm not going to the hospital and then I still want to find other remedies for it, are there natural remedies in curing this? Or
Okay.
Hospital?
So apart from the usual that I've thought about when it comes to, I'm a doctor, I always go for the normal, come, let's see you, let's give you some medication. There have been, talks of cranberry juice, but in all honesty, there have been.
Okay.
But in the world I'm in, it's not something obviously. It's just, they say it helps for urinary tract health. But not that it's killing the organisms. And scientifically, there haven't been any studies or so many studies that can prove that. Okay. So it's something that is just there. Please don't go and use cranberry juice.
Oh, they are doing some things right.
I beg. Let's be honest.
Before I go to bed, I drink cranberry juice.
Well,
good for you.
You can read on it. Well, there's always that.
But it's good for my system, right?
Yeah, it's good for you. It's good for you, but it doesn't solve. And there are lots of they haven't done research into that. So scientifically speaking, I cannot make that statement. Okay, but if I say natural remedies, I mean, what I can say, drink a lot of water. It will reduce the risk.
Okay, so before you go and cut, plantain leaf and all those things to go and grind and drink because somebody says you should, speak to your doctor first.
Yes,
it's very important. Yeah, speak to the doctor first.
So in an instance where so I know that during pregnancy, the first trimester, medications are not administered. Okay, so
you can't say medications are not administered.
Okay.
It depends.
Some are.
Yes.
Okay, so in instances where there aren't, and maybe because due to certain complications, you can't give the woman medication or something. If that pregnant woman is infected with UTI, how do you go about it?
So, in all honesty, no matter what, there's always something we can give you.
Okay.
That's the truth.
Okay.
There's always something we can give you.
Okay.
You may be limited, but there's a way.
There's always a way.
There's always a way. So there's nothing like we have to do it this way, they have to do it that way. Even if it ever reaches that point, we will always let you know what we are doing. And please ask your doctor questions. I mean, a lot of people come in, they do not.
Yeah.
When you go to the consulting room, I'm very practical. I like to know what you know about your illness. You see, and it helps. If you go somewhere else and you had an infection or you had something and a doctor asks you, what did you have before? You'll be able to tell the doctor. And it helps with our management a lot.
Makes it easier.
It's true.
Makes it easier.
They go to the hospital, you ask them, oh, what medications are you on? What did they give you? What did they even say? They don't even remember
They can't,
anything.
yeah, they can't tell.
They don't know whatever they're taking. And it makes it a bit difficult, especially when...
You don't need to remember the name, but you should be able to describe it.
Yeah.
I mean, it helps a lot. It helps a lot.
Okay, let's take about 3-4 more messages. The messages are so many. My God. Good morning. I'm watching you live from Volta region. Please, I learned that using of some birth control methods predisposed women to UTIs. Is it true? How is it possible? This is from Ricardo.
In all honesty, birth control methods, I personally do not know it to cause UTIs. UTIs are just bacterial infections, right? That cause, problems. But as to birth control methods causing that, no, it really does not. It really does not. So I don't know whether the person read it, but feel free. share your research.
It helps.
Yeah, it helps. It helps, yeah.
Yeah. So let's say you have a strong immune system. Could you still get the bacteria?
Oh yes, why not? Why not? And the thing is that that's the thing. Most people, some of the people who actually have strong immune systems, even the ones that normally don't have immune symptoms, you see, they are just,
So don't be
walking around.
Don't be walking around, shoulders high, thinking you have a strong immune system.
You still need to visit your doctor.
Yeah, you still need to.
You still need to.
Yeah, you still need to.
Good morning to you all watching from Upper West. I'm really enjoying the program. God bless you all. Thank you very much for watching. My name is Amanda from JJT. Please, I want to know if UTI makes it difficult for the pregnant woman to have sex. I mean, is it painful? Next one, good morning. Please, I want to know, does taking in a lot of water after sex really prevent pregnancy? Okay. This one says, please, does UTI change the color of your urine?
Oh, yeah. So one of the presentations that I did not mention, you can come with cloudy urine, right? It doesn't look as you would normally, you see it and it's cloudy. It has some color. You can Google it, you see it. So if you see a different or a change in your urine color, feel free to come. Not that it is deeply yellow. If it's deeply yellow, most likely you're not drinking lots of water. Yeah. But if you realize it's cloudy, for those who do not know cloudy, please go on Google cloudy urine. You get pictures. Yes, and you'll be able to.
Okay. Good morning, everyone. Doc, please, is UTI a genetic condition or can you get it from a parent? Because my mom has it, my sister has it, and I have it.
This is not a genetic condition.
Wow.
It is not a genetic condition. Please no, it's not a genetic condition at all.
The sister has it, the mom, and she has it too.
And then maybe there's something in the house.
There may be in the house. Exactly. Please check.
There's some practices.
They're all not doing that. Something right.
So please check that.
You know, at home, when I go home, and my parents are always making fun of me. They are watching me right now. They are watching us right now. They're always laughing at me that before I enter the washroom, it doesn't matter if the washroom is in my bedroom, I will use Dettol to clean the waters. Yes, every time I use Dettol to clean, and I learned it from Wesley Girls. So after I left, it's stuck with me.
With you.
So every time I have Dettol, I clean the water, the seat before I use it.
That's a good practice.
Yeah. So please, for those of you that are living with, 2, 3 more women, okay. So antiseptic, I
live alone, so this is for those living. I live alone. Really, antiseptic.
So I
didn't need party. You
see the way every toothpaste is called Pepsodent. So
actually.
So those of us living alone, we are free from this. To a large extent.
Yeah,
we don't need antiseptic and all of the tactics.
No, but if I live alone,
but that's a lot of work. If you ask me,
I still do it.
Doc, you don't think if you're urinating like 4-5 times in a day?
I tell you, I will clean
who
the
gave you that
seat.
job?
I will clean the seat.
She's not complaining, I mean.
Exactly.
No,
it makes me feel
she'll complain.
safe.
It's a matter of time.
And you know what even makes it worse? What even makes it worse is what I do. So I don't only clean the seat with the antiseptic. I also pour a little bit into.
You know, because you have a problem. You have trust issues.
But is it okay? They're me constantly doing that. It's fine. It's fine.
Why? Are you complaining? You're not.
I'm
You're
not.
fine.
I'm not.
Like, why are you disturbing yourself because of bacteria? No, really. Come on, bacteria. Small biotics are better.
Let's take some more messages. Hi, I wanted to know if UTIs in men can lead to sexual dysfunction. Hello, good morning. Please, can one get UTI from using public washrooms? Yes, you can. And good morning, please. I had this UTI while pregnant, but they wouldn't see. And after my pregnancy, I was treated for candidiasis. But ever since then, I can't hold my urine when I run, dance, or walk fast. Please help. It makes me uncomfortable whenever I'm in public places for a very long time. Wow. I think doc will just end up telling you need to visit your doctor.
Yeah, it's most likely it has nothing to do with a UTI. You know, babies and their whole complications. So you should see a doctor.
Yeah. Good morning, please. I want to ask if you have your period 2 times in a month, does it mean you have STIs?
Oh no. Please see your doctor. Period twice in a month. Please see your doctor.
Yeah. Good morning, please. I had sex with my ex, After that, I asked her to take in medicine. She said no. She will drink more water to wash the sperm away. I'm asking if that is true. Please ask my question for me, please. I've asked
the brotherhood is disappointed in this guy. Like, you allowed that to go? Like, you believe that?
I mean, Kim just answered that.
Like, dude, believe that? Dude, we're disappointed in you. Next time, don't let her go.
Don't try that.
Water? Oh, my goodness.
I have a student in my class who urinates so many times all the time. Please, can this be infection? Oh, so many messages, but thank you so much for your messages. Doc, somebody is asking for your number. And so please, your final words, and if you're okay putting your number out for people to contact you, please do so.
Okay, so my final words are UTI are actually so simple to treat, all right? And the tests are readily available. Please do not keep it with you. If you have any issues, please go to the hospital. Hospitals are right, but I understand there's a long waiting period sometimes, but it's better to actually treat them than not to. Okay, so we are always available. Please feel free to walk in to my consulting room. I'll be there to see you. I'm a nice person, in the consulting.
She is a nice person. Dr. Echama.
Thank you.
And if you...
Doc, please, where can we get you? Because your consulting, you didn't mention where exactly it is.
I work at Legon Hospital currently.
Yeah. Okay.
If you need to contact her personally, I'm the consulting officer in charge of 0256883341.
The number is even incomplete. Guys, thank you very much for being here with us. It's been a very insightful conversation, and thank you so much for watching us right here on Prime Morning. Our guest for Good Living segments, Dr. Akosua Echama.